Hi, I'm Mina Malik Hussain and you're watching The Coffee Table. And you know, we love our medical shows here on The Coffee Table. But today it's not just medicine. We're talking about a very important topic, which I feel is not only important, but it's also something that a lot of parents think about and fret about. And maybe it's a modern disease to be fretting so much about this, but you know, who knows? Which is why we have put together a wonderful panel of excellent doctors for you today. So we're going to be talking about vaccinations here on The Coffee Table. We're going to be discussing vaccines, what goes into them, why are they important, and actually I think that the most important thing that at least I think of when I think of vaccines is our fight against polio in Pakistan. And you know, as we all know, our polio workers are heroes who have been braving all kinds of dangerous climate and social situations to help keep our children safe. And I think that we're in for a really fun conversation. Joining us today from Islamabad is Professor Major General Dr. Salman Ali, who is a professor of pediatrics and child health. He is the former advisor on child health to the Pakistan Armed Forces Hospitals and is the founder principal of the Fazaya Medical College in Islamabad. We are welcoming back on set Dr. Naeem Zafar, who is a member of the National Certification Committee for Polio Eradication. He is the president of the Child Welfare Organization Pehchan and the convener of the Child Rights Committee for the Pakistan Pediatrics Association. And last but not least is Professor Dr. Muhammad Yaqub Kazi, who is a former dean of the IPH and a professor of pediatrics at King Edward Medical University, and is currently the professor of pediatrics at Fatma Memorial Medical College. Wow! Welcome to the show, gentlemen, and General Salman from Islamabad. Well, I like to begin at the beginning, as I always say. So, Dr. Kazi, tell me about a vaccine. So, for a layperson, what is a vaccine?
Actually, since the inception of mankind, various bacteria, viruses, or injurious agents have been infecting humans, giving rise to this disease process.
Right.
The man has been always thinking how to prevent. One way of preventing the disease, which the humans developed with passage of time, and now refined and called as vaccine, is that you identify the bacteria or the virus or the agent which is causing the disease.
Right.
And convert into an avirulent form, which is not harmful for the body, but presents a challenge to your body. And in response to that challenge, human body develops its own defense, what we call antibodies, generally, or train the body cells to fight this infection. So vaccine is a very convenient way, very cost-effective way, and very useful way of preventing very grave and serious diseases like meningitis, like polio, like pertussis, like hepatitis, which have been scavenging or killing people and children in millions throughout the world.
Yes, and over great periods of time.
Yeah,
also.
It's not only the death or the mortality, the morbidity is very high. If a child gets meningitis, he may be handicapped. And 1/4 of the children who at a very young age will develop meningitis are likely to end up in some form of neurological deficit. They may go blind, they may go deaf, they may not be able to walk, they may be handicapped, and so on and so forth. This is just one example to understand the benefits of vaccines. Similarly, there are other diseases like pertussis, what we call as whooping cough, is a very high mortality rate, very high morbidity, leads to...
But what is the difference between morbidity and mortality?
Well, you know, for example, in meningitis, when you get meningitis, some children would lose their life, and we call this, this is the mortality of that disease. Sometimes they survive, but they have certain handicaps or certain lingering problems as final post-meningitic complications, what we call. That is the morbidity, that how many people fall sick and remain handicapped or remain diseased even after the spell of the disease is over.
Okay, so it's not a full recovery. So if you don't fully recover from it, then that's a morbidity.
Morbidity.
Interesting.
And
Dr. Zafar, what goes... So Dr. Kazi mentioned that a vaccine has basically like a denatured virus or a sort of less vicious virus. So what else goes in? So basically what you're doing is that you are injecting a sort of less dangerous strain of the virus into your body, and your immune system then develops antibodies for that. Yes. But
well,
then...
if we convey the message that it is a less vicious bacteria or virus, it conveys a meaning that it may harm the body.
Yes, that's right.
But it doesn't.
Huh.
So these are, in the older times, we used to knock off the bacteria or the virus and inject it. And we would call that that it would not harm the body, but it is a live virus.
Right.
Or it can be a killed virus. Nowadays, most of the vaccines are not using the killed viruses or bacteria as a whole.
Okay.
They are using subunits or maybe genetically engineered.
Oh.
So there is absolutely no chance of them getting virulent again.
I think that's very important.
Yes.
There, that modern vaccines do not have any viruses
Most of these.
in them, most of them, and are by and
Virus are
large
the
very
bacteria.
safe
Exactly.
to take. And which is also why babies, when babies are born, there's a whole sort of immunization schedule that babies have, and clearly that's because babies' immune systems aren't strong enough. And do you think that we need to start vaccinating children from that stage so that we protect them from the get-go and we give them their immune systems a chance to develop so that by the time they're sort of, what age is it where you can fight off bacteria by yourself?
No, actually,
Your immune system becomes strong enough. Like by the time you're 5, you're protected. So it's sort of like a security blanket.
I think the security blanket starts in the womb itself.
Interesting.
And the moment the baby is born, no matter if the baby is underweight, he or she is can still manage to mount a response.
Right.
And that is why we always give the tuberculosis vaccine, which is known as the BCG vaccine,
Yes.
and the first dose of polio at birth.
Yes.
So polio, BCG, and hepatitis B can be given and should be given at birth. So the child is ready to mount a defense. The rest of the vaccines, they start after 6 weeks from a regular interval, which means that the body gets enough time to mount a response. Then we get the second dose, the response heightens, and after the third dose, the immunity is conferred. And through a booster later on, that immunity is conserved for life.
Oh,
that's
so
how it
the
goes.
booster is very important. You need
Yeah.
to
Very
follow that
important.
schedule
Exactly.
to kind of seal the deal.
Exactly.
Interesting. So, Dr. Salman, well, General Salman, excuse me, you have spent your whole career working on child health. So what is the recommended? So actually, basically what I'm thinking of is that, is there a difference between vaccination schedules in South Asia, for example, or in Pakistan versus the West? Are there certain things that our children need to be more protected against as compared to a child growing up in Europe, for example?
Actually, the vaccine-preventable diseases, in principle, our children should be vaccinated against all vaccine-preventable diseases.
Right.
But then since vaccines are definitely, they have a cost, and we get the aid of the international agencies also. See, the government tries to introduce those vaccines where, our children are suffering from those diseases most. So they cover mostly those diseases first. So
Right.
that's why initially when this expanded program of immunization was started, so we started immunization against 6 diseases.
Right.
That is tuberculosis and tetanus, poliomyelitis, diphtheria, and pertussis and measles. These were the top diseases which were the top killers. And then later on, now we have added vaccines against pneumonia, vaccines against diarrhea, the rotavirus,
Yes.
and vaccines against hepatitis B, and vaccines against meningitis, the Haemophilus influenzae. So these have been added. But internationally, there are other vaccines available for other infectious diseases like chickenpox and rubella and, the hepatitis A. But we are really covering those diseases where our children are suffering most and they are causing the maximum mortality, So currently our immunization program is covering all those diseases where our children had been suffering previously, and we have tremendously reduced the mortality, morbidity in our children. Particularly, we know that when we were students, neonatal tetanus was very common and it's one of the top causes of deaths in the newborns. But fortunately, because of the immunization of the mothers, we immunize the mothers also against tetanus, so that their children, the newborns, they have got a defense against tetanus. And because of this strategy of immunizing the mothers, we have now almost eradicated neonatal tetanus, although there are sporadic still reports are there. But we have definitely come a long way in really controlling these main problems of our child health. And inshallah, we will be with the introduction of further immunization, other diseases, including in our immunization schedule. We are going to really eradicate mostly the infectious diseases as it has been done in the West.
That's
and
excellent.
I think it should be understood. Yes.
Yes.
I think it should be understood that in addition to immunization, we need to improve our general hygienic conditions, sanitation, and safe water. These are very, very important elements in addition to immunization if you want to really eradicate the infectious diseases.
Quite right.
They should not be forgotten.
Absolutely. That's something I do cycle back to sort of, later on in the show, save something for later. But Dr. Kazi, I think that what General Salman said about vaccinating mothers actually leads me to my next question, which is of passive immunity, because when mothers are vaccinated, then babies do have
a certain amount of immunity right at birth, which saves them against tetanus neonatorum.
Right. But does that apply for other diseases as well? Because what I'm thinking is that if mothers haven't been vaccinated as children, can they be vaccinated later on? Is it still effective?
Yes. One important message at this time would be rubella is one disease which if a mother gets during pregnancy, the babies would be very badly affected, very adversely affected, and very severe mental retardation is a sequelae, particularly in the first trimester of the pregnancy. So in the developed world, perhaps no mother would like to be pregnant before getting the rubella titer done.
Yes.
And rubella antibodies status. So rubella vaccination is one which I think should be given to the mothers also. That's another example what you wanted me to tell. Similarly, if the mother has good immunity against certain diseases, which is naturally transmitted transplacentally as well, it also transmits immunity against many viruses and bacteria.
Okay.
There are certain immunoglobulins which are transferred passively through the placenta to the babies.
Yes.
As Dr. Naeem was saying that right at birth, the baby can fight a number of infections. And if the baby is deficient in that, the mother is not able to transfer, or the mother is not immune, or the mother's immunity is compromised, or there are certain other factors also, like the baby is born too early, too small in weight and prematurity, so is more susceptible to infections. So summarizing it, what you wanted me to tell to the general audience was that if the mother is vaccinated, there are certain diseases in which the immunity would be transferred to the newborn, and that would save a lot of tension, anxiety, misery, and it also reduces burden in the hospitals. When you used to, about a decade ago, when we used to have a ward of tetanus, of newborn tetanus treatment for the newborns.
Wow, like a whole ward.
We used to have in Mayo Hospital the whole ward, and it was almost always full, because the whole of our people were bringing newborns from all over Punjab, and they were dying like flies, and it was such a big tragedy to listen that this is the only male child after 6 girls, after 3 girls, and whatever,
and
the social
all
concern.
babies are precious.
And every life is precious. And this was a very difficult disease to be treated, and we were wasting a lot of resources on that. So with this methodology, or with this strategy of vaccinating the mothers, we have been able to eradicate it almost completely.
That's amazing.
Let me tell you a very a phenomena which we have just encountered. When we had mothers who were not very well vaccinated against measles, they would develop measles as children, and then they would pass on that antibody to their offspring.
Yes.
Because of that reason, the baby would not have measles infection in the first 1 year of life.
But only up till 1 year. Because passive immunity is only sort of
that generally
intact.
wanes off in time.
Yeah.
So what we used to do is that the measles vaccination, why it was given at 9 months, worldwide it was given at 1 year.
Right.
It was given at 9 months in Pakistan and in the developing countries because the antibodies would wane off and the children would get infected against measles during that period of time. So we used to give measles at 9 months. Now that most of the mothers are vaccinated against measles, when their offsprings, when they are, when their children come into the world, some of them have lesser amount of vaccines because the infection causes more antibody response as compared to the vaccine. So the effect wears off a little earlier. And when we go for vaccination nowadays at 9 months for vaccine, many of these children, they get infected earlier. So what we are thinking is now giving measles vaccination at an early age. In the expanded program of immunization, it is still at 9 months, but when we go for measles nationwide campaigns, we give it from 6 months to 5 years. So
up till 5 years, right? Because that's including the boosters and everything.
No, for the measles, I'm talking about
the earliest dose.
These are the national campaigns which we hold every 2 to 3 years to offset the epidemics that we are likely to contract. But in the EPI, it is normally given at 9 months and then at 15 months.
Right. So to clarify, mothers who have been vaccinated for measles, their babies, they can be vaccinated for measles later on.
No. Let's not confuse. I was telling you an interesting phenomena of a shift from our 9 months or 1 year vaccine to 6 months because the mothers have been vaccinated.
Okay. So basically when you get the disease, your own immunity is just higher generally.
Exactly.
But that is not a reason to not get immunized, because that doesn't mean, I'll just get it and then I'll be fine.
Because then you get a lot of complications.
Exactly. And I want to talk about complications. We're going to take a very quick break. Don't be complacent about measles. Stay with us. Welcome back to the coffee table. I have a big smile on my face, although we're talking about serious things. We've been talking about vaccinations to our wonderful team of doctors. General Salman, I want to ask you about now, we've been talking about measles, and measles has kind of made a comeback into the world over the past few years because a lot of parents have been very nervous about measles, the vaccine, about the MMR vaccine. So could you just sort of throw some light on why we shouldn't be as worried as we generally tend to be?
I think measles, it is one of the most infectious diseases which children suffer from, and it's particularly very, very dangerous if a malnourished child gets measles. The mortality is quite high. And as now just a short while ago we were talking about the defense against measles. Actually, some of the mothers who have got antibodies against measles, these antibodies would basically get transferred to the newborn, and they will initially protect the newborn for the first year or so. But if the antibody titer is less, so they will be protected for a lesser time, and they might get measles earlier. Even we have seen measles occurring around about 5 to 6 months where the antibodies have weaned off,
And that's a very small baby.
Basic protection, it goes. Yes, in small babies. So the basic protection goes off, But in the Western countries, the measles vaccine is administered in combination with the rubella and mumps vaccine, what is known as the MMR vaccine. Yes. So that's very important. And recently, you must have gone through the news that in New York we had a major epidemic of measles when the immunization rates went down, when people get complacent and they don't immunize their children. So it can crop up even in the most developed countries.
Absolutely.
So that's what recently happened in the US. There was a big epidemic of measles in New York, and they had to boost up the immunization campaign.
So, Dr. Naeem, why is measles dangerous? Because, there are a lot of childhood diseases like chickenpox, for example. If you get it, and it's all right if you get it, and then you're fine later on, and it doesn't seem to have a huge it's not terrible. The morbidity is very low. But why is measles dangerous particularly?
Actually, measles is bad because just like General Salman said, that in a child who is already malnourished, it is going to cause a very high mortality. The children will die. But also, those who survive, they have severe pneumonias, severe diarrheas, severe ear infections, meningitis, encephalitis, and actually they lose at least, they lose a lot of weight during this period of time. It's a longer period, so they lose height also. When Imran Khan talks about stunting, the vaccine-preventable diseases is a major determinant to that. So I'm not just talking about measles. All these vaccine-preventable diseases, if we see, those are in the EPI, whenever a child would get these are the ones for which either there is no cure, or the cure is very difficult, or the mortality and morbidities are very high. So for example, there is no antibiotic to measles. So there is no antibiotic to any viral illness. There is no antibiotic to polio. There is no antibiotic to the other viral illnesses.
Any viral illness.
Many of them.
Something very important for our audience to remember, that you cannot cure virals by taking antibiotics, because then you make them resistant, and it's terrible.
Measles virus actually is a very virulent virus.
And what if you get it as an adult? Isn't it like terrible if you get it as an adult?
Even worse sometimes. And it invades each and every cell of the body. So all the organs are very adversely affected with measles. So mortality and morbidity, as Dr. Naeem has already described it, is very high because of the virulence of the virus and because of the involvement of multi-systems in the human body, and particularly malnutrition, vitamin A, vitamin D deficiency, they add on to the high mortality.
And it's again one of those things where it can be prevented. Children don't have to suffer, you can protect them. But I think that's also where I want to talk about herd immunity.
This prevention does not cost anything to the parents. Government is doing it free. That's also very important. This prevention is, it is giving life to these children actually, and giving a perfect life. And once the child is not enjoying good health, he would not be able to carry on his schooling properly. And these children would be very, all the time falling sick, and absence from the schools and so on and so forth would also affect their social life, will affect their financial status of the parents. So once they get these children vaccinated, they are saved from many horrifying situations subsequently as far as the health is concerned.
Vaccinating your child is not as straightforward as saying, oh, I don't want this injection. There's so many things tied into it. And I think that's where then herd immunity is also so important, because it's not just that you want a certain amount, a critical mass of protected people, but there are also people who can't have the vaccine or who are old. And those people, you don't want them to be at risk for a disease, because I think a lot of times people are like, oh, well, if I get disease A, I'm young, I'll recover and it'll be okay. But it's not just about you, it's about the society that you're a part of.
Yes, it is called herd immunity. It is actually the community which becomes very safe once you achieve a certain level of immunity in that community. For example, in API program, when we had achieved 80-85% coverage, the morbidity and mortality had gone down in children under the age of 5 years. So as the coverage drops, you get more disease in the community. So if you, in certain diseases, there is a certain epidemiological principle that if you vaccinate, for example, 80% of the children in certain diseases, rest of the 20% perhaps would be saved because of the herd immunity. They would be getting it automatically. Similarly, in polio, if we able to achieve the coverage up to 95% or so,
that's really
we should actually be, the target should be 100%. And it's such a dangerous disease.
Yes.
Similarly, even all these ailments which Dr. Salman mentioned initially, even tuberculosis and pertussis, measles, tetanus, meningitis.
You see, you had whole wards dedicated to babies with tetanus, and now, touch wood.
If I tell you the economic impact, vaccination actually prevents trillions of dollars. It saves a lot of money. So it is now known that it is the second most cost-effective method of preventing diseases and having healthy children. The first one is safe water. The second one is vaccination. It is cheap, it is effective, and it prevents the diseases at the time when the child is young and the productive life is all ahead.
Yes.
And it gives them a boost so that they can be productive and ultimately useful citizens. And it has been calculated through different algorithms that you actually make trillions of dollars.
Because again, you know, prevention is better than cure, and you instead of spending money on, and especially in a country, in a developing country like Pakistan, where we don't have the funds to be treating anybody their whole lives. Like, why should they? When you can sort of just a series of injections can sort of set you up for life, really. Exactly. So it's a kind of, you know, the balance. We have to sort of strike a balance there. But again, sort of coming back to why there is a nervousness around vaccination, and there are a lot of myths about it as well. And Dr. Kazi, you mentioned polio, and I'm glad you did, because do you feel, Dr. Naeem, that a lot of parents across Pakistan are still nervous about the polio vaccine?
I think the nervousness around the polio vaccine comes because of two major disinformations. The first disinformation is that somehow or the other, the polio drops contain some element which affects the fertility of the child.
Yes.
Now, which is totally baseless, because
not true.
Because we have been giving polio vaccines for decades now, and maybe 15-20 doses every year. We should have, you know, the population should have stopped growing.
Quite right.
But we are still one of the, you know, the highest,
fastest growing nation of the world.
Yes, which means that our birth rate is just fine.
The second one, unfortunately, came in because of the association of polio vaccine with Osama bin Laden. So because of that association, the whole sect or a whole group of people went against it. And that is the reason that currently the polio vaccine is mostly, the polio disease is mostly seen in the corridors between Afghanistan and Pakistan. Last year, we had many cases of polio. We had more than 150 cases, and mostly they occurred during these 2 months, October, November, and December.
Why is that?
Because it was an epidemic, a sort of a mini epidemic, and we had more cases in Pakistan. This year, things have reversed. There are more cases in Afghanistan this year than Pakistan. We have 79 cases to date here and more than 100 over there. So the people are traveling.
Yes.
So people are traveling from Afghanistan to Pakistan, Pakistan to Afghanistan, then from Peshawar to Karachi, Peshawar to other areas. Most of the current polio cases are coming from that particular belt, and because of that particular belief system. We expect that we are controlling it good, and hopefully in the next couple of years, we will be seeing a significant drop in the cases of polio.
Excellent, fingers crossed. We're going to take a very quick break and come back to chat a little bit more about polio. Stay with us. Hi, welcome back to the coffee table. We're having a really fascinating conversation about vaccines, and we've just started talking about polio and all the sort of wonderful efforts that the Pakistani government has been doing to bring it under control. But before we sort of, well, I don't know, I'm full of questions as always, but General Salman, can you tell me why is polio so dangerous? Which is why we need to, make sure that we don't have it anymore. We need to eradicate it.
Yes, poliomyelitis, basically a viral disease, is transmitted through the fecal-oral route, and it has been historically very, very dangerous because it causes so much paralysis, handicap. Most of those who have paralytic polio, they get handicapped and they have got paralyzed limbs. And if you see the scenes from history before the polio vaccination began, you will see scenes of people walking on sticks, being in wheelchairs. So it's a very, very paralytic disease, and it can also cause sometimes encephalitis and death apart from this very, very high morbidity. So that is why it was very important to prevent this, and the vaccines were introduced in the late 50s. And when the vaccine was introduced, there were two types of vaccines, the oral polio vaccine and injectable vaccines.
Okay.
And with the introduction of these vaccines, the polio was almost eradicated in the US by 1980, when in fact our EPI program began in 1978, and we started the polio vaccination as part of the EPI program.
We have a very promising network in place, and we sort of have a net where we're working hard to do it. But one thing that I do want to ask about is that General Salman also mentioned it, and you also mentioned it, Dr. Naeem, safe water being very, very sort of directly linked to the transmission of polio, and sort of it's a fecal-oral route, which is basically like dirty
contaminated water. Contaminated water. Safe water is the first safest vaccine, I would say. I would phrase it like that. That's the importance of the safe water. It prevents a large number of diseases in addition to polio. There are many fecal route diseases.
Because one thinks of, typhoid, for example.
Hepatitis.
But polio somehow never comes to mind when you think of
polio is
water.
so scary. You were asking why the polio people are frightened and why it is so dangerous. Actually, once you get paralysis, just imagine of your one limb not moving, your eyes not working, you can't hear, you can't walk properly, you can't breathe properly. The variable degree of neurological deficit is so horrifying, so terrifying in polio that I am amazed on the state of mind of the people who do not get their children vaccinated, especially against polio.
Because the horror of having a disease outweighs any other concern that
it is
one might have.
unimaginable and a tragedy once you get a polio virus infection.
And
it's a lifelong tragedy.
Can adults get polio, doctor?
Yes, it can occur at any age.
Get it at any age. And measles also.
Yes.
It's not one of those things that it's
all these vaccine-preventable diseases can occur in adults. In fact, the pneumonia vaccine that we give to children, it is now recommended by WHO that every person over the age of 65 should get pneumonia vaccine.
That actually makes a lot of sense. So it's never too late to be vaccinated either. So if you weren't vaccinated as a baby, but as an adult, can you be vaccinated for like DPT and whooping cough and all these kinds of baby vaccines?
Like hepatitis B, one should be vaccinated against hepatitis B at all ages. Those people, we do not vaccinate against whooping cough in the older ages because of its severe reactions in the older ages groups. But the children going to universities abroad, they are now receiving TDAP vaccines, which are slightly lower doses, but which protect against diphtheria, tetanus, and whooping cough. So they are bound to get it because young adults are getting these diseases.
You can get it. So General Salman also mentioned that our polio networks are being used to also combat coronavirus, which is really interesting. And Dr. Naeem, when we don't have a vaccine yet, but we're working, one is developing. So how do you feel about the coronavirus vaccine? Because it is a virus.
Of course. Now the coronavirus vaccine, we are hearing a lot of things about it. But let's be very honest. There are two things that a vaccine has to fulfill. One is safety, that once you inject that particular vaccine to somebody, it is not going to cause harm, which is extremely important. And the second is its efficacy, that it protects against that particular disease. Unfortunately, to date, we have not reached that stage in COVID in any of these vaccines. So we are still far ahead, we are still under trials. Most of the trials are in stage 3 trials. We have 4 stages of trials. And we do not expect a good, effective, safe COVID vaccine, at least by the end of next year. We must know that most of these vaccines, the time period to make these particular vaccines is not less than 4 to 5 years. We are accelerating it, but we can't accelerate it beyond a certain time period because then we are liable to have serious side effects. One of the candidate vaccines was withdrawn because of serious side effects.
Yes.
So we have to be very careful.
So actually the development of vaccines is a very complex process that takes a long time. So if we have viable vaccines for other diseases which are tried and tested and you know exactly what the trajectory is like, then as medical professionals, they were quite confident that they're perfectly safe to take.
Yes.
So but another question about sort of myths about vaccines, and one of them is that there are metals in vaccines and those are harmful for the health. So are there sort of, I know that there's mercury, but you tell me since you are the doctor.
Thank you. Actually, these myths have been to a great extent elevated, and the MMR vaccine is no more that dangerous, because that has also been taken away out of it. But it was proven, there have been so many trials and some court trials, because the children who were vaccinated, they developed autistic problem and autistic behavioral disorders. It's a large spectrum of diseases. Autism, is generally a symbolic representation of many of these group of ailments. So people attributed it to begin with the MMR vaccine and the contents of the vaccine, though it was not a proven fact. And
it still hasn't been proven, and there's
there have been so many
concrete link.
No, actually it has been proven beyond doubt that there is no association of mumps vaccine or any content thereof with autism spectrum disorder. It has been clearly defined that there is absolutely no, and even there was only one paper that has been retracted by the British Journal.
Yes. So Dr. Naeem has very emphatically told us this, and we must take it seriously.
MMR vaccine is...
And this is an international thing that globally everybody agrees that there is no sort of causality there.
And particularly in MMR, we have rubella vaccine, which is very important for girls to have it. Because this is the only opportunity that they're to get it, because as an adult, we generally are not in habit of getting vaccinated.
So there are no heavy metal, there are no sort of significant
there is nothing
heavy
dangerous in it.
Vaccine.
And safety has been established, as Dr. Naeem has told already. And I think there should be no reservation, no reluctance to get MMR vaccination.
On that
And
note,
that too well in time.
I'll just give you another very important information.
Yes.
We've heard about typhoid a lot.
Yes.
We have had typhoid vaccines, which have been polysaccharide vaccines, which has been giving reasonable amount of immunity. But this time round, we have a typhoid conjugate vaccine.
Yes.
There was a large epidemic of typhoid last year in the Sindh province. They imported it and used it. And the Pakistan Pediatric Association was in the forefront. And because of those, I think more than 10 million or 20 or 30 million doses, the typhoid cases have gone down. So now we were to start this typhoid conjugate vaccine this year in Punjab. EPI will be doing it in February next year. So my message to the people is that once we have this typhoid conjugate vaccine in our EPI, we must get our children vaccinated, because it is going to give a long-lasting immunity against typhoid, which is playing havoc right now. The antibiotics which we used to treat typhoid with, they are no longer effective. We are getting more and more resistances. We are going now having extended drug resistance, and the drugs that we are using are now only injectables are being given, and they are very, very expensive, and they cause a lot of pain and discomfort to the child. So typhoid has to be taken seriously, and once we have a good typhoid conjugate vaccine, we must use it.
Please, everybody, take it, because because if the antibiotics aren't working, then the only way to protect yourself is the vaccine. Thank you so much, doctor.
And safe water.
And safe water, absolutely. Thank you, General Salman. Thank you, Dr. Kazi. Thank you, Dr. Naeem, for being on the show. This wonderful conversation was extremely edifying. I'm thinking like maybe I should get some vaccines done as well. Thank you guys for watching. If you're watching this on YouTube, don't forget to like and subscribe. Check your immunization schedules. It's never too late to be safe for you and your family. Take care, and we'll see you next time on the coffee table. Bye now.